Hello, everyone, and welcome back. Today, we are going to be talking about the counselor and the diagnosis. In this section, we will examine the role of the counselor in the diagnostic process, focusing on the relationship between the person and the diagnosis. We're going to explore what a diagnosis actually means, the ethical mandates associated with, its implications for practical aspects such as billing and insurance, and key considerations we must prioritize to ensure competent and ethical practice. We are going to discuss how to maintain client welfare, which is going to be at the center of our work. Let's start by defining diagnosis. We're going to look at two key terms as we explore this concept: assessment and diagnosis. Assessment helps us gain a deep understanding of our client or the mental disorder we are addressing. For example, we're going to use various different tools like anxiety scales, Beck Depression Scale, PTSD screening, whatever it is that we need in our arsenal to gather more information. With diagnosis, this is a medical term, and this can very much sound like and is tied to the medical model. However, there is still a crucial part of our counseling process, and it's essential for establishing a baseline for the client, determining how to move forward with evidence-based treatment, and strengthening the therapeutic relationship. In medical terms, diagnosis refers to the identifying and looking at the disease-causing factors responsible for the illness. So, when it comes to mental health disorders, we know there are genetic and environmental factors at play. And while we move away from the strict medical model and embrace a more biopsychosocial assessment, we still follow the process of identifying the root cause of the issue. And it's important to recognize that while diagnosis remains relevant, our work as counselors also incorporates the humanistic nature of the therapeutic process. So, why do we diagnose? This is a significant question in the profession, especially considering the ongoing debate about whether diagnosis is necessary, particularly if we aren't tied to billing insurance. However, there are important reasons that we diagnose. First, we must conduct an assessment to understand where we're starting with a client. It's crucial to gain a deeper understanding of the individual and their reasons for seeking counseling. What prompted them to reach out? What areas of their life do they want to improve? Having a baseline allows us to choose evidence-based treatments and tailor it to the individual's needs. By grouping disorders into specific classifications, we gain a clearer understanding of possible treatment paths and how we can measure progress. Diagnosis also allows us to provide an explanation for what the client is experiencing, which in turn offers them hope. Imagine not knowing what's happening in your life, feeling lost and desperate for answers. Having an understanding, whether related to physical or mental health, can be a crucial first step in healing. Once we provide a diagnosis, it can be a relief for some clients, even if it is difficult to accept, as it gives them a direction to move forward. Additionally, a diagnosis allows for us to track progress as it ties into treatment planning, and we can evaluate symptomology, determine the most effective treatments, and assess progress over time, comparing where the individual is now to where they were 6 months ago. This is going to be key in ensuring that we're helping the client heal and move forward. Finally, from an ethical standpoint, we're mandated to provide competent, comprehensive, and ethical diagnosis as part of our professional responsibility. And it wouldn't be complete without talking about the ACA Code of Ethics, specifically when we're looking at various different sections. They provide very clear guidance and rationale on the process of diagnosing. First, we're going to look at E5A. This emphasizes the importance of providing accurate diagnoses of mental disorders. Counselors are encouraged to take the necessary time to understand the DSM and the various different techniques, and as such, personal or intake interviews to determine the most appropriate course of care for that individual client. This aligns with the why we diagnose, which we previously discussed. The code also highlights the necessity of cultural sensitivity. We must recognize that culture shapes how clients define and experience their problems. In our early lectures and discussions, we learned about the importance of determining whether a disorder is causing significant disruption or if the factors may be influencing the client's experience. It's essential to consider social justice issues such as oppression and marginalization and understand how these factors might affect how we view a client. Moving on to section 5, B, and C. These are interconnected and they focus on examining how marginalization, oppression, and cultural factors influence diagnosis. This includes understanding the historical context of mental health and the potential stigma associated with it. For example, consider the impact of the past psychological experiences, like the Rosenhan study, which shaped the societal views of mental illness. In this context, we must ask ourselves why a client might be hesitant to engage in counseling and ensure we approach diagnosis with an understanding of their past experiences. And we need to see the client holistically, asking, what is going on? Moving on to E5D, this is important to remember that there are situations where a diagnosis may not be appropriate, especially if it could harm the client or others. Counselors must consider the potential impact of diagnosis, and including whether it's ethical to provide a diagnosis to a client during an acute episode, such as a delusional or a psychotic state. In some cases, telling a client that they are psychotic may only make the situation worse. And these are things that we must consider and highlight, and especially talk about in supervision, which is going to be essential. It ensures that decisions are made with careful thought and not just in isolation, providing a support system for counselors when they face these complex situations. Now we need to talk about the practical aspect of diagnosis, which we've already touched upon from an ethical standpoint, but now in practical terms, a diagnosis is necessary for insurance purposes. Insurance companies will not reimburse you unless you have a diagnosis that has been provided. This process requires thoroughness, taking into account all relevant factors. There is always an insurance company requesting a diagnosis for that intake before approving payment, so this is crucial in understanding this process. This is why we go through the DSM in such detail. It's not just about knowing the diagnostic criteria, but it's about interacting with them, understanding where they come from, how to find them, and being efficient while being comprehensive. So you need to be able to provide the ICD-10 codes when billing. You don't simply state a diagnosis like post-traumatic stress disorder or generalized anxiety disorder. Instead, you need to provide a billing code for the session type and an ICD-10 code for the diagnosis. Insurance companies also recognize that a diagnosis can evolve over time, but it's important to remain consistent with documenting the client's progress. For example, the criteria that we've discussed, such as the duration of the symptoms for depression or the progression from brief psychotic disorder to schizophrenia, can change. So understanding these changes is important for moving the treatment forward in a purposeful way. While this process is necessary, it doesn't mean that it has to be rushed or done carelessly. Whether you're in an agency setting or private practice, you'll need to provide a diagnosis, but you must approach it thoughtfully. It's crucial to understand that we will evolve with our clients over time, and our understanding of their condition may change, and there may be instances when we can't be perfect in our initial diagnosis. Instead, we aim for good enough based on the information available at the time and how much the client is willing to share with us. As a therapeutic relation deepens, so does our understanding of the client and their unique environment. So, what is the clinical purpose behind a diagnosis? Well, earlier we discussed the importance of defining and understanding why we diagnose, but now let's look at the actual clinical purpose. One key reason is to facilitate communication within treatment teams. When necessary, when everyone is in the same diagnostic language, it really helps to ensure that the best decisions are made for the client. If the team members aren't on the same page with the diagnosis, it becomes very difficult to collaborate effectively. This is one big reason why we rely on the DSM-5 so that we can all use consistent language when discussing cases. Diagnosis also guides treatment strategies. For example, the approach to treating adjustment disorder differs significantly from the approach for treating, say, complex PTSD. Similarly, the way that we treat depression is different from how we treat ADHD. So, having a shared diagnostic language helps us develop appropriate treatment strategies and track outcomes. Additionally, diagnosis allows us to assess etiology, the causes or origins of a disorder, by considering genetic factors, environmental influences, in utero experiences, and external factors like trauma or chemical exposure. We gain insight into the root cause of mental health conditions. Understanding the etiology not only forms the treatment, but also provides a sense of direction and hope for clients as it gives us a clearer path forward. Lastly, diagnosis supports the broader goal of scientific investigation. While we are social scientists, We are still scientists in the field of behavioralism and mental health and healing. By using standardized diagnostic criteria, we contribute to the ongoing research and understanding of mental health to help advance treatment and scientific knowledge. So, once we understand the purpose of diagnosis, we must consider several other important factors. One key question is, how does the client view their symptoms? If a client isn't struggling as much as we may believe, whose perspective should take priority? Is the issue pervasive to the client, or is it more situational? This brings us to the role of environmental factors, which we will continue to explore throughout our course, particularly in the context of how disorders present. Was there chaos, trauma, prolonged exposure to violence in the client's environment? What about the impact of parenting style within the family structure? We also need to consider the broader cultural context of the client, and we will delve into the intersectionality of identities, age, race, gender, ethnicity, and how do these factors influence the client's experience? How do societal shifts like the rise in depression and anxiety over the past year affect how we understand diagnosis and mental health? Our field has undeniably been impacted by societal changes and things happening in the world around us. Other critical considerations is counselor bias. Are we seeing what is truly there? Or what do we expect to see? Or what do we fear to see? And why do certain diagnoses carry such a stigma, such as antisocial personality disorder, or, for example, borderline personality disorder? And how does that affect our willingness to diagnose? Are we hesitant to give certain diagnoses because of how a client may perceive them? This is especially important with complex diagnoses where a client may have a strong reaction. How do we avoid giving certain diagnoses, or do we inadvertently overdiagnose by trying to find a label that fits it? These are essential factors for us to keep in mind as we maintain an open and honest perspective with our clients, ensuring that we understand their experiences fully rather than jumping to conclusions based on our initial impressions. Every one of these considerations plays a crucial role in providing effective, ethical, and compassionate care. This ties to our next point, our role as professionals. As counselors, we must be constantly aware of our feelings and our biases in everything that we do. We are our own tool, and we perform our jobs and how we interface with clients. Reflecting on the foundations of this course, it's clear that our ability to provide empathy and connection effectively with clients hinges on our awareness of our own position in time and space. We can't create space for our clients unless we first understand where we are in that space ourselves. Understanding ethics and ethical obligations is essential to counseling profession. It's also crucial to have competency in these disorders we encounter. For example, the DSM changed from 4 to 5, and it caused some confusion as certain diagnoses were revised or even removed, like Asperger's disorder, which is now integrated into autism spectrum disorder, or the introduction of disorders like intermittent explosive disorder or premenstrual dysphoric disorder. This evolving knowledge underscores the importance of continuous education. After completing a master's degree, the onus is on us to stay informed, and how we approach continuing education really matters. Do we choose what's easiest, or do we invest in areas that are necessary for our growth? Our profession requires us to stay well educated and up to date, which is why continuing education is mandated for maintaining our licenses and certifications. Maintaining a therapeutic alliance with our clients is going to demand transparency, especially when it comes to diagnoses. We need to help clients understand their conditions while also deepening our understanding of them. Treatment planning is a vital part of this process, and documentation. It is unavoidable. Intake forms, treatment plans, notes, discharge reports all tie back to the diagnosis, and this documentation must be kept up to date. During your various different practicum and shadowing and internship experiences, you will begin to experience this aspect of work firsthand. Ultimately, it is our responsibility as counselors to collaborate with our clients to establish treatment goals and track progress. Again, continuing education is essential for staying current with documentation, diagnostic changes, and emerging trends in the field. As counselors, it is our professional duty to remain informed and uphold the welfare of the individuals that we serve. This commitment to professionalism and competence is foundational in our work. So, what does it look like long term, and how can we feel confident in our decisions? Well, the DSM 5 provides us with a shared language for diagnosis, but we also need to actively listen to our clients. If a diagnosis feels uncertain, we don't just stop there. We need to actively listen to our clients and explore further. We need to ask questions and pay attention to how the client is feeling, not only what they are saying, but also their behavior and their nonverbal cues. For example, consider someone showing early signs of cognitive decline or dementia. Are we observing all the indicators that may be present, or are we making the necessary referrals that are appropriate? A key aspect, especially in trauma work, is understanding the client's history. So, we may want to build trauma narratives that could be essential to the therapeutic process. We may ask, "Where have you been?" and explore experiences together. It's about making connection and understanding the bigger picture of the client's life. As always, it's important to adopt a thoughtful, reflective mindset. Diagnosis is not a passive activity, it's an intentional, collaborative process where we work alongside our clients to gain a deeper understanding of them, starting from the very first session. Confidence in our diagnostic skills comes through competence, which is built over time and is used very carefully and engaged in practice. As mentioned earlier, striving for good enough rather than perfection is crucial. No one here is perfect, and diagnoses will evolve over time. The more we get to know our clients, the more likely we are to identify persistent issues such as personality disorders. We're going to begin to observe their behaviors, their personalities, and how they interact with the world. And a diagnosis can change as the relationship deepens. For instance, when we first work with a client, they may present with symptoms of maybe generalized anxiety disorder. But over time, if a trauma event occurs or it is disclosed to us, then this may shift the diagnosis. As our understanding of clients grow, so does our ability to offer a more comprehensive view of their mental health. It's essential that we're not afraid of those changes. It's a part of the process of being fully present and attuned to the client's evolving needs. This process takes time, and as we move from the assessment phase to the working stage, clients typically begin to open up more and we gain a deeper understanding of them. What's most important is that we stay focused on what's best for the client, recognizing that developing a full understanding requires patience and an ongoing and evolving relationship. So, once we've completed all the necessary steps, one of the most challenging aspects can be communicating that diagnosis to the client. At the forefront of this process are empathy, honesty, and clarity. It's important to be clear about what we're saying and provide a comprehensive explanation and check in with the client to see how they're feeling about the diagnosis. Do they think it's accurate, or do they think that it doesn't fit? This process must be rooted in our ethical code, considering when it may not be in the best interest of the clients to provide a diagnosis immediately or at all. Communicating a diagnosis is often difficult. It can feel uncomfortable and foreign, both for us as the clinician as well as for the client. However, it can also offer the client a sense of hope and a starting point for their healing journey. Understanding how we arrive at the diagnosis can help shape their path forward, guide treatment, and inform assessment. In the context of telehealth, it can also help determine which clients are more suited for remote care versus those who may require a higher level of care based on their diagnosis. Additionally, we must become comfortable with discussing co-occurring disorders, as many clients will present with more than one diagnosis. And this adds another layer of complexity to our role, but it is something that we will come to with more time and with more experience. So I want you to understand this process and your role in it. It's going to be vital. You will face choices, and it's normal to feel anxious about the diagnostic process. It's okay to be unsure, and I highly encourage you to get supervision. It's about those moments of discomfort. That's where we really grow and develop our skills. So, opening those lines of communication with clients and leaning on supervisors when you need them will help you navigate these challenges. That's it for today's lecture. Thank you, and I'll see you in the next one.